since the baby boomers. My fixed income is broke. My fixed income is broke. My Social Security is a joke. I made 65, now the system is broken. I don't get a check, I get a token. We're the baby boomer generation of diarrhea and constipation. We don't know which way to go, but this is one thing I do know. My fixed income is broke.
Good evening, fellow advocates of the aging. My name, as you know, my name is Keston Boyce, and I'm a student in PA 330. Today, I'm here to discuss the future of Social Security. As we know, and it's been said that the future of Social Security is looking very bleak for those of the future generation. They said by 2040, Social Security will be bankrupt, and right now, Congress has come up with a few ways to try to resolve the problem. One, they want to increase payroll taxes. Two, reduce benefits. Three, privatize Social Security. Four, have a pay-as-you-go system, which is known as the pay-go system. Or five, to increase the national age of retirement. So today, I'm here with fellow students from the Public Administration Department to discuss the future of Social Security.
Fields, I'm 25 and I work for St. Luke's Hospital in the psych department.
Word, she staying for you late?
This is my 14-hour day. I start.
Kenny, I'm 52.
Hi, my name is Natalie Leary. I'm 27 years old. I'm happily unemployed. I'm currently majoring in BPS, Applied Management, and a minor in Public Administration.
Hi, I'm Clarence Berry. Yeah.
Can I say something else?
And I'm already retired and collected Social Security. And
Hello, my name is Joan Parafonseca, and I'm a professor at Medgar, and I'll probably be working till I'm 90. I was not smart. I didn't listen to Jim Harden.
right.
And I gotta work till I'm 80.
How you doing? I'm Keston Boyce, and I'm a student in PA 330, advocating for the aging.
Yes, I'm Monroe, and PA student. Concentration is on public policy. This should be a very interesting debate.
I think that although we should be advocating for these changes not to happen to badly affect us, we also need to come up with backup plans to save so that we don't necessarily have to rely on security, because the state of the government is so volatile and it's not really something that we can rely on to secure us. So our social is not secure.
And I agree with what she's saying. I do think that we have to look out for ourselves, because the way the government is working now, you really can't be, dependent upon them for anything. As you could see, even with pensions, a lot of places, we were just talking about earlier today that in about 10 years there won't be any. So I think you really do need to have a backup plan to rely upon later on.
Okay, well, I guess we're basically all saying the same thing. At this point, we're just working to pay off bad investments and bad decisions from the past. So our generation is more or less, for lack of a better word, screwed, because there's nothing left for us. We're just here to pretty much try to break even on bad deals.
And because in this class, it's called advocating for the aging. And, believe it or not, before this class, I never even thought about Social Security. I didn't think about the state of Social Security, but not knowing that I'm going to be old one day. I'm going to be 65 one day. I don't mean to say old.
You're gonna get older.
I'm gonna get older, and you have to think about, you have to prepare yourself, and we have to look at ways, to safeguard Social Security for when we get that age. We want to make sure that we have something that we can depend on.
Yeah. When I was young, I never thought about being old. I never thought I would be old. I never thought my parents would be old. They're now deceased. But they were very good at planning, and both of them worked for the city, and they had very, very good benefits, and they were able to retire with dignity. So my father retired, and he traveled around the world for 15 years. He was an advocate. He was a social worker, so he became an advocate for the agent and got another degree when he was 80. But I'm a really bad case. I'm a really bad case because I really thought I was going to be young forever. And I looked up, and my hair was gray, and I looked at the in the mirror, and I thought, oh my God, that looks like Aunt Hattie. And I had become Aunt Hattie. So the education that you're getting now is excellent because it teaches you that to look at these benefits, to be in public administration, to be an advocate, because they're talking about cutting benefits for anybody under 40. You guys will be 40 in a minute. You look up, like Errol say, no, I'm not. Yes, you will.
It's like 20 years.
Yeah, whatever. Come visit.
20 years creeps up on you.
I get it to 40.
So it goes, yeah, life goes real fast. So the advice that I give to you is that whatever job you take, inquire about the pension plan. Make sure you sign up. I used to not sign up. I'm like, that's taking $100 a pair of shoes, you know, taken out of my check. I'll never be old. Always think about that. And take jobs that, like, for example, with the Transit Authority, you retire with a pass, you retire with health benefits. So the public sector is the best place to work right now, is the absolute best place, because people are getting fired from corporations with 1 year's severance. Now, you might make $600,000, but you got that $600,000 got to last you forever because you're not getting a pension, and you're not getting any of the stuff that you had. You lived large, it's over. Federal workers and city workers live like this, and they live better as seniors. So you're really lucky that you're getting this education.
That's what the professor was telling us about. Getting employed right now, if you can get a civil service job or something like that, work for the government, because they still have pensions.
They still have pensions. And the university system is number 2 for working in a university because you get educational benefits. So look at the job. It might not sound sexy, but make sure that you look in your public sector before you try to do anything else.
Okay, well, at this point, if anybody has anything else they'd like to share on the future of Social Security before we close.
Well, let me put it to you this way. Right now, I'm 52 years old. I've been working since I was like 18 years old. For anybody to say there's going to be some kind of gambling going on with my future right now, I think that's ridiculous, because I already gave you the best years of my life. Right. I'm not going to be running, I'm not running around no more. I'm not the spring chicken. I can't do the things that I once did before. But I shouldn't have to pay for it because somebody's messing up with the money someplace else. If I would have thought about it back then, I would have been in corrections where I should have supposed to have been. I would have stayed in hospital police with the public in Kings County. But private was paying more. So I got out of the hospital police. I went to St. Mary's Hospital, and overnight, Giuliani turned my job not into police officer, but into security officer.
Right.
So all those things that I should have had was gone. I got my 20 years vested in 1199.
Great.
Here's the problem. With my pension from 1199 and with Social Security, I figured in New York I can't make it. But if I go to Maryland or another state where the prices is lower, I can survive off my pension. But like I said, for right now, nobody should gamble with what I did in the past. I went out there, the things that I've put up with, the struggles I've had, that is, you can't put a price on that. And for somebody to try to gamble it away, somebody to flip the coin and just keep raising the age from 62 to 67, and then what happens when you find out you could live a little bit longer than that? I don't care if you give me immortality. The problem is, I still got the aches, I got the pains. I can't do what I used to. Feet hurt, slow down, heart don't beat the same way. I earned my stuff.